Understanding mental illness, the medical perspective. In recent years, society has made significant strides in recognizing mental illness as a legitimate medical condition. It is important to emphasize that mental illnesses are not merely lifestyle choices or personal failings. They can deeply impact individuals and their loved ones and may manifest through various environmental and biological triggers. In this blog post, we will explore the nature of mental illness, discuss the role of environmental factors, share testimonies, provide affirmations for self-empowerment, and offer resources for those seeking help. The medical framework of mental illness. Mental illnesses, such as depression, anxiety disorders, bipolar disorder, and schizophrenia, are often rooted in complex interactions between biological, environmental, and psychological factors. Research shows that genetics can influence susceptibility to mental illnesses, but external factors, including stress, trauma, social isolation, and exposure to certain environments, can trigger symptoms. American Psychiatric Association, 2013. The World Health Organization recognizes that mental health is a state of well-being where individuals can cope with life stresses, work productively, and contribute to their communities. When mental illness arises, it can impair these functions, affecting overall quality of life. World Health Organization, 2020. Environmental triggers, the hidden factors. Environmental factors play a significant role in the onset and exacerbation of mental illness. Some common environmental triggers include traumatic life events, the loss of a loved one, physical or emotional abuse, and other forms of trauma can trigger mental health disorders. Chronic stress, factors such as job pressure, financial instability, and academic stress can lead to chronic stress, which is linked to mental illnesses. Social isolation, a lack of social support and feelings of loneliness can increase the risk of anxiety and depression. Substance abuse, alcohol and drug use can exacerbate or contribute to mental health issues. Cultural and socioeconomic factors, discrimination, poverty, and cultural stigma can create formidable barriers to mental health, making individuals more susceptible to mental illness. Research insights. A comprehensive review by Barlow et al., 2014, highlights the significance of various environmental stressors in the development of anxiety disorders. Another study published in the Journal of Psychology and Mental Health, Smith and Wilson, 2021, suggests that social support systems can buffer the impact of these stressors, underscoring the importance of community and connection. Personal testimonies. Many individuals have bravely shared their experiences in managing mental illness. For example, Maria, diagnosed with generalized anxiety disorder, recognizes that her anxiety increased significantly after she experienced severe workplace stress. After I learned to acknowledge that my environment played a role in how I felt, I began to seek supportive relationships and set boundaries. It changed everything for me, she shared. James, a veteran diagnosed with PTSD, noted, "It was hard to accept that my experiences could affect my mental health, but I realized that external triggers like loud noises brought back memories that I struggled to manage on my own. Therapy and support interventions were essential for my recovery." Affirmations for healing. Affirmations can provide a grounding influence during challenging times. Here are a few affirmations to consider. I acknowledge that my feelings are valid, and I deserve support. My mental health is a priority, and I take steps to care for myself. I am not defined by my struggles, I am capable of growth and resilience. I will seek help when I need it, and I trust the process of healing. Resources for support. If you or someone you know is struggling with mental illness, please utilize the following resources. National Alliance on Mental Illness, NAMI.org, provides education, support, and advocacy for individuals facing mental health issues. Crisis Text Line, text HELLO to 741741, USA, a free, 24/7 text line for individuals in crisis. Mental Health America, MHNational.org offers valuable resources for mental health screenings, coping techniques, and support. SAMHSA National Helpline, 1-800-662-8787, HELP 4357, a confidential treatment referral and information service. Conclusion. Recognizing mental illnesses as medical conditions influenced by various environmental triggers fosters a more compassionate and informed society. Each person's journey with mental health is unique, often shaped by their environment and experiences. By acknowledging these factors, we cultivate a space for healing, support, and understanding. Let us continue to raise awareness, support one another, and foster newfound conversations around mental health. Together, we can break down the stigma that surrounds mental illness and empower ourselves and those around us to seek the help we deserve. Remember, a mental health challenge doesn't define you, what matters is how you respond to it. References: American Psychiatric Association. 2013, Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Barlow, D.H., et al., 2014. Environmental Factors in the Development of Anxiety Disorders, a Review. Journal of Anxiety Disorders. Smith, J.P., and Wilson, R., 2021. Social Support and Mental Health, Buffering the Impacts of Environmental Stress. Journal of Psychology and Mental Health. World Health Organization. 2020, Mental Health, Strengthening Our Response. Remember, you're never alone, and there is always support available.